And recently, we have seen that many members of our critical workforces that work in the hospitals, that work in athletics, and other critical elements of our universities are having to isolate and quarantine because of the rapid spread of the Omicron virus. To give you an update of where we are with respect to this virus, as you can see from the chart on the left, that shows the 7-day moving average for just Boone County. And recently we had the highest number of daily cases at 430, which is the highest we've seen throughout the entire 22 months of the pandemic. And the chart on the right, the graph on the right, shows county by county those that are considered to be hotspots in Missouri. And all four of our universities are in locations, are in counties that are considered to be hotspots with at least 150 per 100,000 in terms of daily cases of COVID. And so this is a wave that we are seeing that it from the map of the United States, it appears to be more concentrated at the moment along the coasts, but it is coming towards the center of the country where we are located. So the strategies that we've used at the university is to encourage vaccination and boosters. And many of our universities, we're going to have on-campus vaccine clinics to allow faculty, students, and staff to get those vaccines and the boosters. But also we have used temporary masking using the guidelines of CDC, but also there are other tools in our toolbox, including social distancing and limiting, postponing, or moving to Zoom large gatherings and meetings. But we are also developing contingency plans at the moment to address potentially critical shortages in various units, including MUPD, the police departments at the other universities, MU Healthcare, dining, res life, and so forth. I want to go back to the use of temporary masking. And according to the Mayo Clinic, face masks in conjunction with other aspects of other tools that we have in the toolbox is effective in helping to spread the slow of the virus. It is not 100% cure, obviously, but it does help the spread, the rapid spread of the Omicron virus. But the CDC also recommends correct use of the mask and correct types of materials to be used for the masking, as I've shown in this slide here. Now, questions are being asked throughout the country, do masks work? And what I'm showing here is the University of Washington model that shows the estimated infections in Missouri as a function of time and with the preventive measure of masking and what impact the masking will have on the number of cases that we expect to see going into the future. And as you can see from the difference between the plumb line in the projected cases and the mask line, the number of cases, if 80% of the population were to mask, as you can see, there's a dramatic difference. In fact, if we determine the difference day by day of those two scenarios and sum up those differences, 80% masking in the state of Missouri will reduce the infection by over 1.1 million people. So scientifically, it will have the effect of reducing of transmission of COVID that will result in less Missourians getting affected by COVID. When we look at how other universities have dealt with this, there's been a mix of different approaches. But currently, as you can see from here, with the exception of Missouri Southern, where the language that they use, that they expect students, faculty, and staff to wear masks in classroom, all the other universities have a masking requirement, at least in the classrooms. And they are using that as one of the tools in the toolbox to address the pandemic as it is rapidly going through our communities. So at this point, before making the recommendation, which will be for a temporary masking requirement, I'd like to stop here and ask if there are any questions from the board members.
Moon, your chart on the effects of masking, I'm assuming that is dealt with if everybody's masked and it's masking full time in where you can't social distance and indoors for the complete population. I'm assuming, is that a correct assumption or not?
That is a correct assumption that they are masked when social distancing is not possible in all settings, and that it is assuming that 80% of the population is masked, not 100%.
And if my understanding is correct, Boone County or the city of Columbia today has a masking order in place?
They do not.
So for the general population of the city of Columbia and Boone County in particular, we would be ahead of the curve relative to what the leadership of those communities are doing. And then I have to, since we are a small part of the population, I'm somewhat skeptical of the effect that our students will have given what the cities and the counties doing, whether we'll have an impact at all on COVID relative to masking on our campus.
So those two-part question. The city has not implemented a masking requirement. Second, in terms of the impact of masking indoors in the classroom settings or offices or teaching laboratories, that will have an effect on the overall transmission within the community because we are a large part of the community. Our students are, we represent out of a population in the town of Columbia of 108,000, there are about 25,000 students here. In Rolla, I would say that percentage is also a sizable percentage, but in St. Louis and Kansas City, they're much larger metropolitan areas.
Our students are in class or labs how many hours a week roughly for the average student?
If they take 15 credit hours, let's say their contact hours is about 15 to 16.
So our proposal would mask them for those 15 or 16 hours, and the rest of the time, the students would act however they want to, either mask or not mask at their own will for the rest of the time.
Yes. When they are at home, when they're in the residence hall, they're in a much more socially stable environment as opposed to being in a classroom where they may be sitting randomly next to one student one day, but a different student a different day. So it's socially a much more unstable environment in that situation. But it will reduce. Mask wearing in the classroom, laboratories, and inside of buildings will reduce the transmission of the virus in those settings.
Moon, do we have any idea of whether, if we didn't make it mandatory, if people would and it was, highly recommended, do you feel as though the students and faculty would wear masks in that case, and we would just have a small number of people that wouldn't do it if we just made it recommended?
I would say that there would be many people, many faculty, students, and staff that would wear the mask regardless of the mask mandate. But there will also be individuals that will not wear the mask. And you may recall watching some basketball games in stadiums where masking inside the arena is required, but you could see on television that many people are not wearing their masks in some settings. And so it really does depend on location and what the expectations are. But many people will wear the mask. That is true.
Moon, this is Jeff. I want to go ask one more question.
Sure.
You talked about the community, protecting the community.
Mm-hmm.
And it sounds like the city of Columbia and the county do not have a mask mandate. I don't believe Columbia Public Schools does, but I cannot remember for sure. Do you know the status of Columbia Public Schools?
Columbia Public Schools does not have a mask mandate, no.
Okay. And are you talking about N95 mask, or are you talking about just cloth mask?
We're talking about cloth masks that follow CDC guidelines, and using what they recommend is cloth masks. If you have N95, that is great, but the cloth mask with double layer of the cloth mask and fitted properly.
So let me ask you about that, because I know in the materials it says 2 or more cloth masks. So are we suggesting that everybody needs to wear 2 masks in the classroom, double mask plus?
That is recommended, but any masking will be better than no masking at all in terms of serving as a barrier of the transport of the virus.
Thank you.
I have a question.
Yes.
When the campus went to virtual learning,
Yes.
that was last year. How did we come to that conclusion to close the campus?
At least here in Columbia, and I believe that was the case in all of the counties, there was a lockdown order, and so we were not able to have, unless there were essential emergency personnel or medical professionals, they were not allowed to travel, and so it was a lockdown.
So when we went to the virtual learning, that was basically because of the lockdowns.
That's right. Back in March of 2020, yes.
Did the curators vote on that lockdown, or is that just something that we had to do because of the lockdowns?
We had discussions with the curators. I don't believe that there was an actual vote that was taken. And it was a very rapid moving situation, but the curators did have input in our plans.
Okay, thank you.
Moon, I want to clarify.
I just wanted to clarify on the mask issue that the double layer is not 2 masks. I don't see that it says 2 masks in the materials, but my understanding is, those single cloth masks that people started wearing, or the little neck thing that people would put over their some of those had single layers, and I think that
That's right.
response to it was, those cheap disposable masks that you can buy that are typically blue, they have 2 layers. But the other comment I just wanted to make was that the N95 masks, is my understanding, are still restricted to healthcare professionals, and those are the only masks that would protect somebody from if otherwise no one is wearing a mask. Those are the only masks that would potentially protect you if you chose to wear that mask and others weren't. So in terms of availability, I assume those are still not readily available for people to buy, students to buy in Columbia. Is that fair to say?
Yes, and there are shortages of N95 masks as well, and so we are preserving those for healthcare providers. And you're right, this is a cloth mask with 2 layers, and most cloth masks that are being sold have 2 layers in them. Yes, Curator Hobrock?
In my conversations with you earlier, Moon, and I want to make sure I understand things correctly. Is this being driven more for a continuity to keep the campus open for our staff to be available to serve our students? What's the driving issue here? Are we trying to protect the health of all of Columbia and Boone County, or are we trying to keep our university open?
We're trying to keep the university open, but in the process of keeping the university open, we do believe it will reduce the number of transmissions within the community. Our students are part of the community. Our students work in restaurants, and they work in our dining halls, and they're a critical component of our community. And so they're not isolated from the rest of the community. And I do know the fatigue that many of us feel with regards to COVID, but the opening of the university in a few days here, well, at all four of our universities, we would like to have as much in the toolbox as possible to get over the peak, which, as you saw from the chart that you're seeing now, is going to occur on the 15th or 16th, and then reevaluate the situation on February 3rd.
If it's